Good afternoon, everyone. My name is Carly Berge, and today I will be presenting on my culminating project, which reviewed the unintended consequences of the COVID-19 response on early childhood health. I do want to take a moment to ground us and respectfully acknowledge that we're calling in from various areas across Turtle Island. I myself am working remotely from Kelowna, BC, which is the traditional, ancestral, and unceded territory of the Silix people, whose land I am very grateful to live, work, and play on as an uninvited visitor. The Ministry of Health, where I did my practicum, and the University of Victoria operates on the land of the Coast Salish peoples, including the Lekwungen, Songhees, and Wasanich territories. To give you all an idea of the background of my practicum project and the need behind it, I would like to present to you the issue at hand. The COVID-19 pandemic and the essential response that public health has provided in Canada have disrupted the everyday lives of children and families, and many of the essential services were shut down at some point with fewer activities available to children, and the repercussions of all of this is now emerging in the research. My 450-hour practicum was completed with the Women's Maternal and Early Childhood Health team at the BC Ministry of Health, and I mainly worked with the early childhood side of the team. This project on the impacts of COVID-19 was of interest to the team because, firstly, childhood is a crucial period of development and it can determine future health trajectories later on. Second, childhood vulnerability is already on the rise, and BC has one of the highest rates in all of Canada. And finally, there's a possibility that these vulnerabilities have worsened because of the pandemic. The purpose of my project was to first review the current research being conducted in Canada on the impacts that COVID-19 is having, specifically on early childhood health, so specifically ages 0 to 6, and combine this data into an annotated bibliography. Second was to map the data onto the Early Childhood Health Work Plan, the ECH work plan, by pulling out themes from the research. Oops, sorry. There we go. And the third was to provide clear policy recommendations to help direct the Early Childhood Health team's strategic policy direction. And this was done through an information briefing note. After putting together all of the research I could find, the Early Childhood Health team met with key stakeholders and BC researchers to see if we could gain early access to their preliminary results so that I could leverage it into my project. I also presented to the BC Healthy Child Development Alliance so that I could share my findings and get insights from these many service providers' perspectives to be used in my final recommendations. For my systematic review, I included 19 research articles in the final analysis. Of the 19, there were 10 quantitative surveys, 4 commentaries from various types of service providers, and 5 systematic reviews, 8 of which were conducted in BC, and 11 were Canada-wide, 2 being specific to Ontario and 1 conducted in Quebec. These were then mapped onto the 3 of the 5 early childhood health work plan goals. Here's a brief overview of the 6 themes that came out of the literature, along with which early childhood health work plan goal they met, and I'll go into this in more detail. These findings, along with the final point of gaps in research, are what I use to make my final policy recommendations. In terms of physical health, research showed that food insecurity, so not having access to affordable, healthy, and culturally relevant foods, is on the rise in BC, with 1 in 5 households with children experiencing it. So that's 20% of the population of BC. Partially because of this, 42% of children are eating more unhealthy, so junk foods, but interestingly, they're also spending more time cooking healthy meals with their families at home. Rates of physical activity also varied by household, but in general, there was a decrease in about half of the Canadian population and an increase in leisure screen time in about 90% of BC children. The second finding of mental health has been one of the most researched areas and seemingly the most adversely impacted too. The literature is showing that about 70% of Canadian children are showing deterioration in at least one mental health domain. I was really surprised that this was even the case in the 2 to 5-year-old age group. New preliminary findings are also showing that children are doing worse than their parents think when comparing children's self-reports with parental reports. The third theme that I'm sure everyone here is very acutely aware of during the pandemic is socialization. Roughly half of all Canadian parents reported an increase in positive interactions with their children, which is great. But on the other hand, nearly 3/4 of children in BC are spending less time socializing with their friends. In terms of relationships, 1/4 of Canadian parents also reported more negative interactions with their children. So this was defined as an increase in conflicts, use of discipline, and yelling or shouting. Of major concern for families during this pandemic is the increased risk factors for family violence, including financial strain, isolation, and substance use. It's not all bad though, thankfully. One of the few positive impacts that was seen was an increase in adoption of hobbies among children in Canada. Research shows that about half of Canadian children are spending more time inside on new hobbies, and 25% reported an increase in outdoor activities. Of these, the most popular were arts and crafts, puzzles and games, and video games. We are seeing, however, that the service closures associated with the pandemic response have been really difficult on BC families of children and youth with support needs, or CYSN, as funding for respite, which is a service that provides caregivers and parents with support and relief from their caregiving duties to prevent exhaustion and burnout. And this respite funding was cut off for most families, and diagnostic services were canceled. Also, during the 3-month switch to online classes, it's estimated that as much as 80% of all BC children with disabilities or neurodevelopmental needs were not fully able to switch to the online platform and fully participate without their usual resources, educational assistance, and specialized learning environments. The final theme that I reviewed was population-specific impacts. Asian Canadians in BC have reported higher rates of discrimination and racism, with 61% adjusting their routines to try to avoid being called names or insulted in the streets, and just over half were worried about sending their children back to school for fears of them being bullied in in-person class settings. Also, 32% of BC residents report experiencing financial stress during the pandemic, and it's estimated that as much as 43% of the population will later in the pandemic. Equity considerations that were noted included how rural, Indigenous, children and youth with support needs, and low-income families were the most adversely impacted by the pandemic response. Many of these families were already having a hard time before the pandemic, and their circumstances were exacerbated by service closures and fewer supports being available to them. Because the impacts to children's health and daily lives have been so vast and widespread, it'll be important to provide interventions on multiple fronts and by various organizations working together to try to mitigate some of these impacts. With this in mind, my recommendations were to first enhance cross-divisional and cross-government collaboration to support children and families. And while this was specific to the early childhood health team, I think the pandemic and the emerging research provides a great opportunity to start conversations for all organizations and fields that promote health. The second is to create an effective monitoring and surveillance system that builds on this amazing research that's happening on the COVID response. And the third is to improve the accessibility and coordination of the healthcare services for children and family that we're seeing that they really are missing and needing. After completing this project, I think there's an opportunity during and after this pandemic to apply a social justice lens to take care of the groups that have been discovered to have already been disproportionately struggling before the pandemic even hit. We don't know what the long-term impacts of the pandemic response will be, but I can certainly say that if we don't act now to veer children's health trajectories back on track, we could see some catastrophic events. I'm looking forward to seeing what the response looks like with such amazing organizations like the Early Childhood Health Team at the BC Ministry of Health advocating for children. And with that, I want to thank the Women's Maternal and Early Childhood Health Team for allowing me to complete my practicum with them remotely over the last few months. I especially want to give a big thank you to my supervisor, Kalila, for her vision on this project and everything she taught me about working in government. And I also want to thank my second supervisor on this project, Christina, for helping me find my voice throughout this process and helping me with the creation of the final briefing note. And finally, I want to thank Victoria for your guidance during this whole practicum experience. And with that, I will open the floor to any questions.